today we're reporting 263 new COVID-19 cases in the state. This does include 11 new hospitalizations and 4 new deaths, one among a Bennett County resident, one from Clay County, one from Corson County, and one from Minnehaha County. We have had 237 individuals recover to the point where they're no longer able to transmit the COVID-19 virus. And we've had a total of 2,256 new tests that have been reported to the Department of Health in the last 24 hours. This does mean that our total COVID-19 case count in the state has risen to 15,834. Of those, we have 2,456 individuals who are considered actively infected and 13,201 individuals who have recovered. We currently have 83 individuals who are hospitalized. We've had now a total of 177 deaths. And the total tests that have been reported to the state are 213,660. Those are among 159,250 unique persons. I did want to provide just a brief update on Sturgis Motorcycle Rally. So we have a total of 125 cases that have been identified among South Dakota residents. And then just a little bit of information around the cases, COVID-19 cases among young children as well as young adults. So CDC in a call earlier this week had mentioned seeing increasing cases among the college-age students, 22 years of age. And so looking at the data for South Dakota, we do see the total number of cases in a given week increasing between the end of August and, the end of July through the end of August. One example is that the 4th week in July, we had about 100 cases in each of those populations, the 5 to 17-year-olds and the 18 to 22-year-olds. Those number of COVID-19 cases rose to 160 among those who were in the 5 to 17 years of age, and to 600 cases in that week at the 4th week of August among those who are 18 to 22 years of age. So definitely seeing some increasing cases among those individuals who are aged 5 to 17, or the K through 12 aged population, and those who are 18 to 22, who are the college age population. Now, in that same data that I analyzed, we did only see 3 hospitalizations among those 5 to 17 years of age, and a total of 7 hospitalizations among those in the 18 to 22 years. And among both of those groups, we saw 0 deaths. And again, this is some data that I had analyzed from July 19th through September 5th. So that's some information there around the youth cases that we have been seeing, which we've been seeing increases both in that K through 12 school-age children as well as the college-age youth. And that information is also available if you're looking for the total case counts on our Department of Health website. Go ahead and visit our information there. It's just below the dashboard, and you can see our numbers updated on a weekly basis.
All right, I'll go ahead and unmute the lines, and we'll take your questions. We're ready for your questions.
Good morning, JP from KORN News Radio.
Go ahead, JP.
Thank you very much. You getting any more feedback regarding the study regarding possible 260,000 cases related to the Sturgis Motorcycle Rally?
So, we obviously have read through that study, and we haven't seen nearly that number of cases being reported to us, both in the state of South Dakota as well as from other jurisdictions. And so, I think the actual cases on the ground are, more reflective of the situation than the projections from that study.
If I could follow up on that, is that the only study out there that related to the Sturgis motorcycle rally that you know of?
To my knowledge, that is the only existing study around that. Obviously, we welcome academicians at colleges and universities to take a look at the data that's out there, to take a look at the study that was done, and to kind of continue the discussion around what we know, which is that when we do have a number of individuals who come into close contact, and that there is a risk that occurs, and that risk increases with increasing number of people, with the different locations that individuals might be coming from, and when individuals are not taking individual action to reduce the risk of transmission in those settings.
Thank you.
Next question.
Jeremy Fugelberg, Florida News Service.
Go ahead, Jeremy.
Yeah, ABC News just released the state-by-state White House Task Force summary and recommendations for COVID. And I'm looking at South Dakota's, and this is dated from Sunday. And there's the very first bullet under recommendation says increasing case counts and remarkably high test positivity in the context of insufficient testing levels are deeply concerning. And they recommend aggressively promoting social distancing and use of face masks or face coverings, particularly in indoor settings and statewide. Now, I know this is something the Argus had sought from Governor Noem's office, hadn't got it, and also had been turned down by the White House. And looking at this recommendation, I'm just wondering if you could respond to what they're saying as far as insufficient testing levels, and then also asking whether you consider the state's approach to be aggressively promoting social distancing and face coverings.
Well, Jeremy, this is Secretary Malcolm Risden. We've been very clear with getting the CDC recommendations out to the public across the state, where our current campaign is exactly on this topic about the need to continue to social distance. And so we are very much in line with that, and that's a part of all the messaging that we make, whether that's to media, to the various groups that we talk to individuals that call our 800 number. Anybody that visits our website will see that front and center. So I think we're very consistent with that message. Relative to test positivity rates, that is a factor that we monitor on an ongoing basis, and we are looking to see our test volumes increase. You'll recall that we initially set a goal of more than 2 times what the minimum requirement was for testing in our state, and we've exceeded that goal every single month since July. We're going to be looking at more opportunities for testing so that we can make sure that we are, again, notifying people that are positive of COVID so that they can stay home, stay isolated, and stay safe.
Next question.
Ray from Carolina News.
Go ahead, Ray.
I just want to talk a little bit about contact tracing and school districts. I know last week you mentioned you increased by 60 people in that staffing. Can you give us how many people are in contact tracing staff and how it's going? Just
so Ray, we did surge staff as we were seeing increases in cases, which we expected to have to do, and so we actually surged about over 100 people, both DOH staff and some contract individuals that we have as part of our response. And so we look at the numbers every day and ensure that we're getting to cases in a timely manner. Again, one of the biggest things that inhibits us from getting those case investigations done in that 24-hour time period that we're striving for is when people do not pick up the phone or they don't call us back. And so anything you can do to help get that word out, that's really important. It just helps us do the work that we need to do so that people are appropriately informed about what they need to do to stay safe. So we also do work very closely with school districts when there is a positive identified amongst a student or a staff or faculty member of a school. The schools have been great to work with relative to helping us identify potential close contacts in the school setting, and so that helps kind of expedite that process, and we can get to those close contacts
Can you give me an idea about, you said you added 100, what's the total staff number look like for contact tracing?
So at this point, we have 243 individuals that are working on the investigation, contact tracing, 10-day notification processes. There's a number of processes that are involved with that.
Next
Okay,
question.
thank you.
This is Stephen Gross from the Plainsman and Huron.
Go to Stephen, and then to the Plainsman.
Yeah, thanks. So South Dakota has the nation's second highest number of cases per capita reported over the last 2 weeks. Sorry, can you hear me?
Yep.
So in light of that, are people in South Dakota doing enough to prevent the spread of the coronavirus?
Well, Stephen, I think, as we've talked about on these calls before, when we see people coming together in community settings, we expect to see more cases. And so I don't think people should be surprised by that. I think, again, people need to continue to follow the guidelines to the greatest extent possible. And so when you are out and about, please, use social distancing, stay 6 feet away from other people. If that's not possible, consider wearing a face covering or a mask. If you're ill, you need to stay home. If you're a close contact, you need to self-quarantine. So that basic guidance remains. But, if you're going to see schools reopen, if you're going to see events over, weekends like Labor Day, you're going to see more cases. So I don't think we're surprised by that, and most South Dakotans aren't either.
Next question.
Can I follow up with that?
Sure.
So, schools are reopening across the country, not in every state, but in many states. Labor Day is happening. Is there anything that you are seeing unique about South Dakota or our region that there is a higher rate of new cases over the last couple of weeks?
I mean, I think, and not having seen exactly the increases that other states are seeing, I mean, I think they're looking at different approaches, and I think folks on this call are familiar with, the homeschool approach versus a hybrid model versus an in-person model, and it kind of goes back to that original discussion around, anytime that we are bringing individuals together, there's always a risk, and so I think without knowing the proportion of schools in other states and seeing the increases that they might be seeing associated with that, it's hard to really comment on it. But what I would say is, anytime you're bringing individuals together, you're going to have times where you're having COVID-19 transmission, and that's a risk whether you're in South Dakota or whether you're in any of the other states.
Now we'll go to the Huron Plainsman.
Yes, just question with the, I guess, mass testing, if you want to call it that, of state fair workers starting tomorrow. What will be the Department of Health's role within that? And then a second part to that question, just the question of what went into the determination of who would be part of that testing process, because right now there's some people who are wondering why certain workers at certain establishments were involved but not others. So just question involved there.
So then the Department of Health is providing all of the supplies, testing supplies needed so that mass testing can happen. You'll recall that that's scheduled for tomorrow and then a week from tomorrow. So we'll have 2 different opportunities in the community of Huron. I would just like to give a shout out to Dr. Carr in Huron, who's really organized this effort, and really appreciate the ability to partner up with he and his team and other folks within the Huron community to make that happen. So he will be doing the specimen collection. We have a state courier available that will be bringing those specimens to the State Health Lab on Friday afternoon, and we will be doing the testing here at the State Public Health Lab. So we're very involved with that process and look forward to supporting the community in that way. In terms of the prioritization of people that will be able to be tested, obviously this is geared towards individuals who may have been exposed as a result of working at or supporting people that attended the state fair. So that's, kind of the priority population.
Next question.
This is Morgan
Jonathan
with
with the Argus Leader.
Go to Morgan, and then we'll go to the Argus.
Thank you. So you guys are saying that the message is to social distance and wear masks. That's your campaign. And, the recommendations we're looking at from the White House Coronavirus Task Force are to aggressively promote that. Our governor is not doing that. Do you think that is doing any harm to South Dakotans?
Well, Morgan, I would disagree with that. The fact that we here on this call are continuously asking you to help us get that message out, I feel like under Governor Noem's leadership is, something that you need to keep in mind. And so we're not doing this outside of her leadership and in recognition of what those CDC guidelines are. So I would respectfully ask you to help us get that message out because you all have a big reach and can be very helpful in that.
Next question.
Yeah, among the K through 12 cases, have you guys been able to identify any trends in transmission from like child to staff or staff to child? And can you also tell me how many school districts are participating in your Sentinel testing program?
I can answer the second question first, Jonathan. 61 school districts are participating in the Sentinel testing, and so that does remain an opportunity for the others that may still be considering that option, and we would encourage that.
And as far
Is Sioux Falls one of those?
Excuse me?
Is Sioux Falls one of those 61?
I don't have the list in front of me. I'm sorry.
Okay. And sorry about the trends. I interrupted you.
That's okay.
And as far as some of the data around exposures and stuff, it is difficult to identify exactly, where exposures are occurring. We've not seen larger clusters, identified in the school setting. Most of what we're seeing are individual cases that have been able to, be contained through a lot of the efforts, the mitigation efforts that school districts are taking and putting into place. And so, I think one of the things to keep in mind is, when we're looking at this, there are multiple sources of potential exposure that individuals have on a given day. And so tracking it down to one specific, exposure event is often difficult to impossible when we're talking about COVID-19, given the asymptomatic transmission. But we have not seen, as I mentioned, large-scale outbreaks within most of these settings.
Next question.
Ray from Keloland.
If I could ask another question.
We'll go with Ray, and then we'll go to Morgan.
You were just asked about the governor and whether or not she was participating in aggressively promoting social distancing and the use of face coverings per the White House recommendation task force. I'm looking at a Twitter photo from 5 days ago where the governor is pictured without a face mask in close contact with people in the 5 to 17 or certainly the 5 to 22 age range at the state fair. I can't tell if it's indoor or outside, but I think that was what Morgan was asking and what others are thinking. How does that fit into aggressively promoting social distancing and the use of face coverings?
Well, Ray, I'm not familiar with the picture that you're referencing, and so I would encourage you to contact Governor Noem's office directly in reference to that. But again, as the Department of Health that works for Governor Noem, we are actively promoting that guidance.
Now we'll go to Morgan.
I'll let Ray follow up.
Yeah, so in general, if I describe that kind of photo to you from a public official, would that be something you'd be concerned about?
Again, Ray, I can't comment on something that I've not personally seen.
Okay.
And we're going to continue to promote the CDC guidance as it pertains to what people can do to take responsibility around COVID.
Thank you.
Yeah, so the last bullet point in this task force kind of recommendation or summary is saying that the hospitalization data may be underestimated or underreported, which may lead to like a lower allocation of critical supplies. I'm wondering if the DOH is like reporting all of the COVID hospitalizations accurately. I don't know. I guess I don't know if you've seen
So
this.
Morgan,
or if
yeah.
you
So
that.
I think what you're seeing in that report is a generality. Because of the size of our state, we are very confident in those numbers, and we reach out to hospitals every single day to get those data. And if we see any anomalies or anything that might be might be unexpected, given their history of either serving COVID patients or not, then we call to make sure that there's not a problem with the data. So I'm very confident in the hospitalization data for South Dakota.
Okay, and then if I could just follow up with what Ray was talking about and the aggressive promotion. Like, I understand that, like, the media, we have a good reach and we can tell other people to social distance and wear masks all day long. But are you saying that, like, you want us to tell, like, our elected officials to follow that recommendation from you guys? Or what should our role be?
I think your role should be to continue to inform the public about the steps that they can take. This isn't a situation where people can do it for other people. And so, we're really just urging people to get the facts, be mindful of what they can personally do, and stick with those recommendations. I mean, people have been at this for a long time. It's easy to just kind of move away from some of those recommendations because they can be, irritating or frustrating. But we really need people to stick with this and continue to be mindful of what those recommendations are, take them seriously, implement them until we're at a different point in this response.
Next question.
Yes, Todd Epp, Kello.com News.
Go ahead, Todd.
I'm not sure if this is for the Secretary or for Dr. Clayton, but in reporting the daily hospitalization numbers, which I think you all have said is a pretty important number, what number of hospitalizations would you need to see and then say, boy, we have a problem on our hands, or to put it in the vernacular, that you would push the panic button? Would it be 100 in a day, people in the hospital, 200, 1,000? I mean, is there a number that you all have that says, boy, this is things are bad?
Well, Todd, a couple of things there. You'll recall that earlier modeling had us preparing to see worst case scenario of up to 5,000 people on a given day needing hospitalization care for COVID. So thankfully we're not even in the ballpark of that. We've not seen a day over 100. And even as we've seen our case increases and our test positivity rates increase, our level of hospitalizations has remained very low. So I think people, again, need to kind of put all of those pieces of the picture together when they're really evaluating how we're doing at the state. We've asked hospitals to, ensure that they continue to have capacity while they continue to serve people that have other needs other than COVID. And so that continues to be part of the strategy that we use. But I can't say that we've identified a specific number. I think the other thing that needs to be part of the equation is how sick those individuals are in the hospital, whether they're utilizing ventilators or otherwise in the intensive care units, because those are obviously factors that can come into play as well. But we're not even close to seeing numbers that would be of major concern. The other pitch I would make is that our hospital systems work extremely well together. So if we do start to see increases in hospitalizations in one area, we have very good protocols in place so that we can get patients to where there are available beds. And again, our hospital systems really work well together in those kinds of arrangements.
I might follow up briefly, and I know you don't have any control over this, but I think Iowa on their dashboard gives the percentage of hospital beds available in the state. Is there any kind of, do you have any kind of metric on that says,
yeah,
you know, we're at
exactly
such and such capacity?
Yep, we have exactly that, and I don't know if Josh or Derek can pull that up for you, but the last I looked, we were using approximately 3% of our hospital beds for COVID patients.
Yeah, and 46% of our hospital beds are available.
Totally
okay.
available. Yep.
And that's on the website, correct?
It's on the hospital capacity tab of the dashboard.
Okay, thank you.
Next question.
Please Strubinger, SCPB.
Chloe?
Hey, thanks. So in one of the recommendations that was released, it talked about testing needs to be expanded across the state. Are there any plans to expand that testing going forward?
Sure. So we were constantly working on testing and making sure that providers have supplies, helping them get supplies if needed, that people understand the folks that should be tested, and that has evolved since we began responding to COVID. We are working on some specific strategies right now to increase testing. We've offered mass testing to all the universities in the state as an example of where testing could be potentially very useful. Again, we're working with long-term care facilities on sentinel testing and ensuring that continues. And so we've got a lot of different strategies at play, and I'm confident that we will see, again, the testing goal exceeded this month by probably the largest number yet.
Are asymptomatic folks considered in that should be tested? Or should they be considered?
Yes, especially household contacts of positive cases.
Next question.
Ray from Callahan.
Okay.
Hi, just to follow up on nursing homes and the original recommendation on testing for percent rates based on the 5% test rate. You had mentioned, Secretary, several times talking with federal officials to get some more specific information on that so that it could be more community-based if the rates were above 5% or have you made any progress with that as far as where that's at?
Yeah, as a matter of fact, we had a good development this week in that CMS, which is the federal agency that is putting this requirement out there, is allowing nursing homes to use state data relative to the county that they're in, and we think that's going to be more reflective of the actual situation on the ground as opposed to older data that the federal government would have. So that's a development in that area, and we're working very actively with our long-term care facilities in the state to be ready and able to implement those new requirements.
Can I just say, that would seem to mean that we could have more nursing homes moving to like phase 2 or phase 3 or moving into that reopening ranks further.
We have a detailed plan that speaks to different levels of operations for nursing homes based on what they're seeing within their facility for positive cases and then kind of what's going on in their communities. And so that is, kind of dependent on those two factors in terms of the activities that are recommended at any given point.
All right, we have time for one more question. Last call for a question.
If no one has any, I can follow up on that.
Okay.
It's a good thing for nursing homes if they can get those if they can use the community percentages, correct? I mean, that's a good thing. That means that they'd have better chances of opening or reopening in phases?
Well, again, I just want to be clear that the community numbers tie to the requirements for testing of staff.
Right.
In those facilities. And so we think using the data that we have at the state level will be more reflective of what's actually happening in those communities, and there won't be the delay in terms of implementing those requirements if they were to have to use the federal data, which would be outdated. So we think it'll be a better match for those nursing homes having to do the testing if they get to use state data.
Okay. Thank you.
You're welcome.
All right, thank you all for joining us today, and we will visit with you